It's just a part of getting old and still trying to stay active.
It's just a part of menopause. There's nothing I can do about it.
Both pregnancies my bladder has been like this. All that pressure just makes it leak. And the back pain doesn't help the situation either.
I just can't wake up in time to go to the bathroom.
Oh, this just happens when you reach my age. Things could be worse, but I wish I could sleep through the night.
There are as many excuses as there are symptoms, but if you experience bladder and bowel control problems, you should know that you are not alone. In reality, about 25% of adults between 25 and 55 years old have experienced leaking problems at some time. 35% of individuals 65 or older have leaking problems. And in nursing homes, over 50% of the residents are incontinent. Even children suffer from leaking, with 10 to 15% of kids ages 8 to 16 having nighttime wetting problems. But this is not a secret you have to live with. Loss of bladder and bowel control can be effectively treated and often cured.
I was sick and tired of making excuses to my friends, so I finally just told them that my bladder was malfunctioning. It felt good to get that off my chest. They encouraged me to go talk to my doctor about it.
After 8 years, I finally had enough of it, and I mentioned it to my doctor. My daughter kept telling me I could get help. It wasn't something I had to accept as part of the aging process, and she was right.
Not only is it beneficial to seek treatment for loss of bladder and bowel control, but it can be quite detrimental for it to go untreated. Untreated bladder and bowel problems can lead to social isolation and depression. Some individuals will spend over $1,000 per year on special continence pads and products, an expense they often can't afford. And loss of bladder and bowel control is second only to dementia as a reason for nursing home admissions. Until recently, the only exercise thought to aid bladder and bowel control was the Kegel exercise, a conscious tightening of the pelvic muscles. Kegels help some people, but others find the exercise confusing and difficult to perform.
Kegels was no good for me. I didn't even know what it was supposed to feel like.
Yes, I was taught Kegels during my first pregnancy to prepare the muscles for childbirth. It helped a little with the leaking, but it was always a conscious effort to get to the bathroom.
Studies show the Roll for Control program to be more effective than traditional Kegel exercises alone. 61% of the people using Roll for Control were dry in only 3.5 weeks, but only 48% of the people doing Kegels were dry, and that was after 6.5 weeks. Roll for Control gives better results in only half the time. Bladder and bowel control can be better understood when looked at as part of a larger dynamic system discovered in the early 1990s, which we now call the pelvic rotator cuff. The pelvis is the scaffolding for the organs and muscles involved in continence. The bladder and bowel are supported by a bowl of thin muscular loops which form the pelvic diaphragm muscle. This bowl is attached to the pubic bone and sacrum. It also attaches to the arcuate tendon or white line, as seen here. The arcuate tendon runs from the pubic bone to the ischial spine on either side and interdigitates with the obturator internus muscle. The obturator internus connects the pelvic diaphragm to the leg bone by making a 120-degree turn at the lesser sciatic notch and extending to the femur. The rollout action of the femur is caused by contraction of the obturator internus muscle. When it contracts, it pulls on the arcuate tendon, which lifts the pelvic diaphragm, closing off the outlets for bladder and bowel control. The roll-in motion of the femur is due to contraction of the adductor muscles. When they contract, electrical impulses travel up the adductors and transfer energy to the pelvic floor muscle, helping to maintain proper resting tone with the bladder and bowel outlets closed. Armed with the knowledge of this system, we can go beyond Kegels to a treatment protocol which involves lifestyle changes, physiological quieting, and the Roll for Control exercises. With Roll for Control, loss of bladder and bowel control can be substantially reduced or entirely eliminated. Chronic back pain can often be corrected. Standing balance and walking will also improve.
I used to enjoy 2 cups of coffee in the morning and tea with my friends in the afternoon. but all that caffeine was irritating my bladder.
Out of tea?
Oh, I had to give that up.
Don't you miss it?
Oh, a bit, but like I said, coffee and tea makes you pee. Water every day, I'm free to run and play. If I were you, I'd give up the caffeine now so you don't run into problems later.
Now I look forward to my daily walk. After doing the exercises for a month, my balance has improved to the point where I no longer need to use my cane. Plus, Doc explained that walking naturally works the rotator cuff muscles. As my heel hits the ground, my hip rolls out. As my toes press against the ground, my hip rolls in. This natural roll in and roll out motion of walking continues the exercise routine without even thinking about it.
This is a mood ring. I use it for my hand warming exercise.
Then think to yourself, my hands are warmer and warmer. Warmth is flowing into my hands, warmer and warmer.
It's a cool trick. When my hand warms up, the ring changes colors. I use this and some other things from the PQCD to help calm my autonomy.
The autonomic nervous system is the message system running from the brain to the bladder. If the brain senses that the bladder is full, it tells it to contract upon reaching the toilet. Sometimes the messages get confused, and the brain thinks the bladder is full, telling it to contract more often than necessary. The feeling of urgency leads to frequent toileting, which can disrupt your lifestyle.
At first I didn't want to bother with this CD, but after using it for a week I realized that it really does calm my bladder. And it gives me a good chance to rest while my daughter takes her afternoon nap.
To begin this exercise, find a comfortable place to sit or recline.
Exercise, lifting weights and perspiring, that was my first thought, but the doctor showed me how easy the exercises are. So on my patio, I work with my roll for control ball and band. I have to lie restfully in the chair for a few minutes each day while I relax and focus on my breathing. That's not strenuous at all. I love it. That's nothing like the exercise I was afraid of. Now my back pain and prolapse is better. My bowel has improved. My leakage is gone. And doing exercises on the wedge really feels great.
My favorite exercise? Because it's easiest to do any time of the day, is the standing plie. I couldn't believe what a difference a few simple exercises made.
Another great tool that enhances roll for control is the use of biofeedback. It gives both patients and healthcare professionals important information about muscle activity to achieve the maximum benefit from a treatment program. All of this may seem like a large undertaking at first, but consider this. Would you rather spend a few weeks practicing a treatment program or the rest of your life suffering through incontinence? And why specifically roll for control?
Well, my doctor suggested several options. I didn't need surgery, and I certainly didn't need any more pills. I take enough pills now, and I didn't want any more. So my doctor suggested roll for control as an exercise and lifestyle change solution.
If you're pregnant or postpartum and battle leaking, I highly recommend Roll for Control. I'm totally dry now, and my back pain is gone.
For me, menopause hot flashes weren't a big deal. It was the bladder urge nonsense that got to me. Thank goodness for Roll for Control. After 3 weeks of treatment, I was completely dry and have been ever since.
Just your talking about it has helped a lot of our friends. I know Joan had the same little secret. And now she's gone to the doctor and is talking about it with him.
It's such a simple solution. I can't believe I waited so long hiding my secret.
Well, I'm not afraid of wetting the bed anymore when friends spend the night. Because now I can sleep through the night or wake up in time when I have to go.
My pants will be as dry as a desert sand dune until the day I die. Roll for Control is the best step you can take for independent living if you suffer from bladder problems.
And now I can wear skirts or dresses. Woo! And I can sit through an entire church service without having to get up to go to the restroom.
The Roll for Control program has been effective with everyone from children experiencing bedwetting to women during pregnancy and after delivery, from menopausal women to men recovering from radical prostatectomy surgery or those with benign prostate enlargement. The elderly aged 70 to 95 have been able to maintain their independence and bladder health by using Roll for Control. It has been effective in individuals with multiple sclerosis and Parkinson's, after stroke, and patients who have received total hip replacement. Roll for Control has even assisted those in early stages of dementia and Alzheimer's. To summarize, Roll for Control is a protocol which includes lifestyle changes, such as reducing caffeine consumption and drinking 6 to 8 glasses of water a day, walking 20 to 30 minutes per day, and getting adequate nightly sleep. Physiological quieting helps balance the autonomic nervous system and control sudden and frequent urges to use the toilet. And the Roll for Control exercises help strengthen and balance the pelvic floor muscle to control bladder and bowel function, reduce back pain, and improve standing balance and walking. If you or someone you care about struggles with bladder and bowel control, talk to your personal healthcare provider. The first step is to stop feeling ashamed. Know that you are not alone, and help is close at hand. For more information, ask your healthcare professional about Roll for Control or log on to www.phoenixpub.com.